Hello everyone, my name is Dr. Silas Muwanga from Rocket Health, and today we are going to talk about mental health. This is something many of us may or may not have heard about, and whenever the word mental health comes up, there's so many things that come through all of our minds. So today we are going to go through this together, and we are going to look at the various ways in which mental health affects us, affects our daily lives, and the decisions we keep making at a conscious and a subconscious level. So the World Health Organization defines mental health as a state of well-being in which an individual realizes their own ability and enables them to cope with the normal stresses of life. They can work productively, fruitfully, and are able to make a contribution to society. So in one way or another, the mental health affects how we handle stress, how we relate to others, and the choices we make, be it at a conscious or a subconscious level. Mental health, according to this definition, is not just the absence of a mental disorder. It is more or less a state of well-being through which an individual will realize their own potential, and it's more of a spectrum, okay? It's more of ascending steps, and everyone is at different levels of this spectrum of mental health. So there is nothing like mental health to in itself define or limit itself to someone being mentally unwell. It can be either mentally okay or mentally unwell. So any individual can move between the steps through the continuum at any one step in time. So how would we know if someone is mentally healthy? What are the characteristics that we see from these kinds of people? These kind of people feel comfortable around themselves. They feel reasonably secure and adequate, and they would neither underestimate nor overestimate their abilities. Mentally healthy people tend to feel right towards others, and this means that they are actually and genuinely interested in others and are able to love and trust them. And at the same time, they are also able to meet the demands of life. They are not overwhelmed, or they are not taken in by their emotions of fear or anger or love or guilt. There are various warning signs that can let us know if an individual has a mental health disorder. And these signs may be things that we can pick up on, we can notice, and sometimes we may not be able to pick up on certain things, because without this person telling you what they're going through, you may not be able to understand what exactly is going on. So some of the few things, or the few telltale signs that can let us know if someone has a mental health disorder: this person is always worrying. Yes, by default, human beings are always going to worry about various things in our lives, but then when people have mental health disorders, this is taken a bit too far. This is a bit exaggerated. They are going to worry about even the tiniest of things that they may not even be in their power. They are going to be unable to concentrate because their minds are always in a state of worry, a state of panic, a state of anxiety, and they're not going to be able to concentrate and even get simple things done. This is going to lead to situations whereby there's going to be decreased productivity at work. They're going to have unhappy relationships with other people, with their significant others, with their families. These people consequently are going to continually be unhappy and without justified cause. And what usually happens at most times is people with mental health disorders tend to lose their temper quite oftenly and easily. They are easily upset by the tiniest of things. Like, let me say you just stepped on their shoe when you're standing in a queue with them. Normally this wouldn't be something that would make someone tip over and lose their temper, but when these people have these mental health disorders, they may lose it, they may lose their temper because of something that may not even be normally provocative towards them. People who have mental health disorders suffer from insomnia. Insomnia is a condition whereby someone is unable to get sleep in the night, and this actually makes them develop conditions, diseases that are due to the fatigue, and the brain is not resting. People who have mental health disorders tend to dislike to be with people. They exhibit tendencies of self-isolation. They do not want any form of human interaction whatsoever. If they have children, sometimes you would tend to notice that their children get actually on their nerves more than they usually do, and they are genuinely afraid without actually having any reason or any genuine cause to be afraid. And People who have mental health disorders have something called illusions of grandeur, whereby they think they are always right and the other person is always wrong. So common examples of mental health disorders and conditions that affect human beings include clinical depression, anxiety disorders, whereby a patient is always in a state of panic. They get panic attacks that sometimes can even require hospitalization. There are bipolar disorders that involve patients usually having unstable moods. They are happy this one moment and they are depressed the next. They have varying moods. Schizophrenic disorders. These are patients usually suffer from mood disturbances, mood alterations. Personality disorders. People who have they have split personalities. It's like two people in one. They're also the common things, like OCDs. These are obsessive compulsive disorders. People sometimes we term as nitties, or because they pay so much, like they're obsessed with various tendencies and habits. So we are going to take a deeper dive into depression, because this is something that is very, very common amongst us. This is something many people, many friends, family members suffer from without actually knowing. And globally, 264 million people suffer from depression. This is actually a very big figure. And statistics have shown that women are more affected by depression than men. Well, this is questionable, because maybe because women tend to be able to speak out and seek help compared to the male counterparts who deal with depression by stomaching it in and not telling people about it. Depression can sometimes lead to suicide. Most times people who are depressed tend to develop suicidal thoughts and tendencies. And 76 to 85% of people in middle and low income countries do not receive treatment for clinical depression, much as treatment is available and affordable. So we want to look at some of the causes of clinical depression in humans. Family history, things like the genetics have been shown to play a key role in predicting whether an individual is going to develop a mental health disorder. And studies that have been done amongst family members and specifically in twins show that there is a 40% incidence chance of one twin developing depression if the other twin did it before. And things like early childhood trauma. The first 5 years of life is usually a period when a child is developing. It's usually a period where it lays a foundation for how they're going to be able to handle issues as an adult, of how they're going to be able to look at life as an adult. And studies show that when developed children under the age of 5 are exposed to childhood traumas, things like neglect, things like childhood abuse, they tend to grow up to become adults who are at a high risk and probability of developing mental health disorders. Chronic medical conditions. Let me say someone has got diagnosed with let's say COVID-19, because it's what has been happening in this time and age. People may get depressed because of this diagnosis. Terminally ill patients, patients who are battling diseases that are not curable, cancer patients, patients who are in their end stage of HIV/AIDS. These are patients who are prone to developing mental health disorders. These are patients who are prone to developing depression and can even tend to commit suicide because they have lost all hope. They've lost all hope of living. Drug abuse. What happens with drug abuse is that people tend to become dependent on these drugs. They're not able to function without the drug in their system. Let it be alcohol or things like cocaine, things like heroin, name it. And what happens with this dependence is if they're not able to get this drug, their life depends on it. And without this drug, they're not able to function. They get into depressed modes. And stressful events in our life. Yes, life is always going to be stressful. There are going to be so many things that will not go according to the way that we want them. Let me say it's loss of a loved one, because life is not permanent. People die. Let me say loss of a loved one. Let me say you've lost your job. let me say, whatever it is, these are things that usually push people into the depression. And how do we know, how can we tell if someone is actually depressed? People feel empty, they feel sad, they feel hopeless, they do not have interest in all their hobbies that they used to do. They just go to their homes and all they want is just to sleep or to just drink themselves silly or just inject themselves with whatever substance they use. And they have reduced energy and they don't want to do anything. There's going to be disturbances in sleep and appetite. They don't want to eat. They're going to lose weight. They're going to become emaciated, and they're going to always feel feelings of guilt, like they're blaming themselves. I could have done better, I could have done so and so, and this usually yields low self-esteem. People who are depressed are not able to concentrate on their work because they don't have even interest in what they're doing. They feel like all this is for naught. They have given up hope. The good news is that depression, like most other medical conditions, can actually be treated and can go away. But however, if left unchecked, if left unmanaged, if ignored or pushed under, can go on for a really long time. It can be months, years, and all this may significantly and adversely affect the individual's life, the individual's activity, and even their productivity. So how do we manage depression? The important thing is for these people to recognize their symptoms, recognize how they are feeling, and reach out to someone who can help them. Mild to moderate symptoms of depression can be managed by things like psychotherapy. This involves looking for and speaking to a psychiatrist about how you're feeling, and this person can professionally guide you on how to effectively deal with how you're feeling. Physical activity, physical exercise is actually good for these people who are feeling depressed. It helps engage them, it helps to distract them from whatever they are thinking about. Because remember, they have all these thoughts, all this anxiety, and all this worry they have, and physical activity is always a good distraction for them. So in cases of patients who actually suffer from the severe depression symptoms, it has been recommended that there are actually medications that can help them with these symptoms. And these medications are medications we call antidepressant medications, and these can be prescribed to you by your psychiatrist according to the symptoms you're experiencing, and they can give you appropriate dosage. And it is important for people taking this medication to know that this medication, it takes a while to work, around to 6 weeks, so patience is really key for these people. And much as you are on the medication, it is also important not to forget the first modalities or the first treatments we talked about. Talk to someone, it also helps. Engage yourself in physical activity. Do not let yourself be idle. Always make sure you're engaging yourself in something. Yes, you may not feel like it because you feel down, you feel hopeless, but try to do something about it. Try to make sure you're not just sitting around, because the more inactive you are, it is going to make you just keep on thinking of how depressed you are, and it will not help the situation. And you may actually end up developing suicidal ideas because of the inactivity. So physical activity is a really, really good thing for you. Talk to a psychiatrist, talk to someone, seek help. In patients dealing with mental health disorders, specifically depression, negative thoughts are a very common occurrence. And one of the consequences of these negative thoughts is suicide. So suicide is an act with a fatal outcome that is either deliberately initiated by the person in the knowledge or expectation of its outcome. That is, someone voluntarily wants to end their own life. And it is to be different from a suicide attempt, in that a suicide attempt is a injurious behavior, but with not the desired outcome, accompanied by evidence, whether it is explicit or implicit, that the person intended to end their own life. And in medical practice, you receive many patients in the ER after a suicide attempt. And it is very key for medical professionals out there to carry out a careful assessment and to ascertain if this patient is at a risk of further attempts, or in other words, they still have active suicide ideations. we want to look at the statistic worldwide to see how big of a problem suicide actually is. And amongst the causes of death worldwide, suicide is the 12th leading cause of death, with an estimated million people taking their lives every year. And that roughly estimates to around one person takes their life every 40 seconds due to suicide, and is actually the second leading cause of death amongst 15 to 29-year-olds. And close to 101 million people die by suicide every year, and 79% of these suicides happen in the middle and low income countries, of which Uganda happens to fall into these categories. Yes, we all have known people who have lost close friends due to suicide, and it is something that we acknowledge. Yes, it happens. It's not something we can just turn a blind eye to, because it actually does happen, and people lose their lives to suicide. You may not know, someone may really be fine this day, they may be laughing with you, and just to hear you come into office tomorrow like so-and-so hung himself, or so-and-so took their life over this. So it is not something we can turn a blind eye to, and we need to always be vigilant and aggressive to combat it. So we are going to look at risk factors for suicide, and by risk factors we try to look at various causes or various situations that help us predict if a patient is likely to commit suicide. Yes, sometimes they may not be 100% accurate, but they help us be able to anticipate and be able to prevent patients from actually committing suicide. So amongst the most common risk factors for suicide involve mental health disorders, such as depression and alcohol abuse. According to statistics, up to 90% of the times a patient has committed suicide, they have also been found to have been battling a mental health disorder, whether it is depression or schizophrenia or bipolar disorders. Most of these mental health disorders, if poorly managed and unchecked, usually result into the patients taking their own lives. In people who have experienced loss and maybe bereavement of a loved one, or divorcees and people who are suffering from loneliness, racial discrimination, financial problems, they have suddenly lost their jobs, they have chronic pains and illnesses, people who have grown up in regions of extreme violence and have maybe for one reason or the other have had abuse during their childhood traumas. Such people are at a risk of getting suicide. And the strongest indicator of suicide risk is a history of a previous suicide attempt. And that is why earlier on we had mentioned that in the era you're going to see many patients who come in after attempting to commit suicide, and most times these people who have once attempted to commit suicide will most likely attempt again, and there is no telling if they're not given the help that they need, they might actually be successful in ending their own lives at the next attempt. And although women are reported to attempt suicide 3 times more than men, men are however at a greater risk of actually completing and going through with their suicide ideations. So how can you help people in your community who are attempting suicide or contemplating suicide? Most times suicide is an unavoidable condition, and 60% of the patients who actually attempt suicide never seek help. And how can we reach out to these people in our community and prevent them from actually going through this suicide? First of all, since suicide in itself is more of an impulsive decision, in that the patients who attempt and even commit suicide usually have like an hour of deliberation and thinking about it, it is very important to remove access to the means of suicide that these patients can use to end their lives. This could be things like firearms or sharp objects, or things like pesticides and opioid medications, because these are the common modalities or the common ways that these people choose to end their own lives. And luckily there is so many treatment modalities that are available in the hospitals and in the community, and we even as Rocket Health can offer some of these treatments to you. Things like mood stabilizers for the depressed patients, antipsychotic medications, the antidepressants. We talked about them earlier on during our talk about our depressive patients, and psychotherapeutic interventions medication which widely has been viewed as helpful for patients. However, little evidence has been shown for that in stopping suicide tendencies. So we need also to educate the patient and the family, and also to keep on continually reassessing for their safety and also assessing their risk for suicide frequently. We need to make sure these patients have regular and frequent visits to their psychiatrists, and we as Rocket Health actually have some of these psychiatrists on board, and if you want to speak to one, we promise you there will be confidentiality between your information, and all you have to do is to just SMS care capital C, capital A, capital R, capital E to 8080, or you could call our customer service toll-free line on 0800 277 015, and you'll be able to speak to our team of customer service, and they'll be able to connect you to one of our doctors or even connect you to our psychiatrist. So I want to urge you, do not die alone in your bedroom. Do not let our family members or even your friends, do not let them suffer in silence. Help is here, and there's so much that we can do for them, even if it is just talking to them. And we, at the end of the day, all we care about is for them to be in a good state of mental health, and to treat them and assure them of their mental health disorders.